So I am pleased to inform you that the ISF College of Pharmacy is organizing an expert talk series, and we are gathered here for our expert talk, Dr. Prashant Tiwari. So, sir is basically a associate professor in the Department of Pharmacology, Dayananda Sagar University, Bangalore. Sir is expertise in the animal pharmacology, animal handling, as well as the multiple uh, molecules for the neurodegenerative disorders as well as the CNS aided functions. So, I welcome you, sir, for this expert talk series organized by the ISSCP MOGA.
Thank you, sir. Thank you. It's my pleasure.
So, sir, before taking much time, so you can start the presentation, sir.
No issue, sir.
Presentation comprises of 30 minutes.
Yeah.
So you already know the regulations of that.
Yeah. Sure, 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 sure. My pleasure.
So you can start, sir. You can share the screen.
Yeah. Let me see. So just I wanted to know this system. How do I can enlarge this screen? Can you suggest me, sir?
Sir, you
Yeah.
can click the shortcut key below the zoom area. सबसे नीचे सर आप शॉर्टकट की है उसको सर सिलेक्ट कीजिए या F5 की होगी ना आपके सिस्टम में इसको क्लिक कीजिए F5.
Yeah. Yeah.
Sir, sir, there is no issue. You can continue with the same pattern, sir.
Okay.
Slide is visible.
Yeah. Okay.
Actually, there is a sign near to 59%. You can click on that box. That it will be automatically adjust to screen.
सर सबसे एंड में जो चार बने हैं ना कॉलम चार बने हुए हैं सिंबल्स
There is a
उनमें
square
से
box in the corner, sir. Square box in the yes, sir.
यस
Yes, sir. Now it's clear.
Yeah. Thank you, sir. So, shall I start, sir?
यस सर यू कैन स्टार्ट.
Yeah. Thank you. Very good afternoon, sir. Thank you very much.
Sir, it says
I'm
now,
very.
sir, screen has been removed.
It
इसको
has been
चलिए सर
removed. Okay. Okay. Let me see.
फिर से कनेक्ट कीजिए सर.
Yeah. Yeah. Sure. Is it okay now?
यस सर फुल स्क्रीन पे कर लीजिए.
Yeah.
ओके.
Very good afternoon, everyone. Myself, Dr. Prashant Tiwari. I feel blessed and privileged to have this wonderful session organized by ISF College of Pharmacy. First of all, I must greet and congratulate Dr. Dilpreet, who is working hard behind this and who took the initiative to invite me. And because of many efforts, this momentum has come to have a deliver this session. And also, I'm very thankful to the ISF family who is really doing a marvelous job into the area of pharmaceutical sciences. So, without taking much time, we'll continue this session. So, today I will discuss about the neurodegenerative diseases. What are the neurodegenerative diseases? What are the existing drug therapy available for the treatment of neurodegenerations? So there are many drugs available for the treatment of Parkinson, Alzheimer disease. These are the most common neurodegenerative disorders. So as we knew that because of their therapeutic utility and poor permeability and poor bioavailability, drug doesn't able to cross the blood-brain barrier. So in this regard, what are the options? As we knew that there are many conventional drugs such as memantine is there, donepezil is there, which are currently being used for the management of neurodegenerative diseases like Alzheimer and Parkinson. So rightly, I told you, because of their poor permeability and poor bioavailability, drug doesn't able to cross the blood-brain barrier. And also, meanwhile, these drug causes several severe adverse effects. So how we can manage those adverse effects as well? So can we have any alternate tools? Can we have any alternate options to manage those disease and disorders? Yes, why not? So India is the richest sources of medicinal plants. People are using all those medications into their lifestyle, but because of lack of information, we doesn't have any scientific inputs of those importance of medicinal plants. So we are not able to use all those things. If we can extract those things, we can isolate, we can validate, and what can be a probable dose for the management. So this is our challenges. However, if we are proceeding with our work carrying this medicinal plants, so job is not easy because plant contain many things, so which constituent is responsible for the management of any disease or disorder. That is one of the challenges. Still, we can expect a good number of result to manage any disease and disorders. So in this regard, this work has been done by my research scholar under my guidance. So that is the one of the extension of work which we have not presented anywhere else. So this Filiformss basically we have selected for this management of neurodegenerative disease and disorders. So this is an schematic presentation where we can see how can we manage a neurodegenerative diseases using medicinal plants. So there are many medicinal plants such as Butia monosperma, Tinospora cardifolia, Calcia filiformis, so which are in use for the treatment of many CNS disorders. Why can't we think for the management of neurodegenerative disorders like Alzheimer and Parkinson's? So these plants may helpful or may can be as an best alternative of the existing drug therapy for the management of neurodegenerations. So here, as we knew that there are many concepts, there are many etiological and pathophysiological factors behind the neurodegeneration. But what are the major factor? Who is responsible for the neurodegenerations? So basically, this amyloid beta, because of the accumulation of proteins, there are chances of progression of disease. As we knew that there are many conventional drugs also, which I have already mentioned, they have their own disorders and merit and demerits. So this study was basically undertaken by the induction of the Alzheimer disease. So we use the scopolamine to induce the cognitive dysfunction for the management of AD. So what are the basic problems we are facing in day-to-day lifestyle? So as we knew that there are certain drugs which are being used, and there are many D2 receptor agonistic like bromocriptine, cabergoline, uh, etc. But during long-term administration or prolonged administration of such drugs causes several ADR like dizziness, postural hypertension, resistance, etc. Reactive oxygen species and is one of the major challenges. They are responsible for the aggravation of this free radicals are responsible for the aggravation of Alzheimer disease. So, due to aggregated amyloid beta protein and hyperphosphorylated tau proteins, they obstruct the communication between the neuronal cells, which causes several challenges and cognitive dysfunctions. So in this regard, what are the roles? So basically, this work deals with the several goals. As we knew that the management of day-to-day lifestyle is very difficult. Now we are getting so many diseases and disorders. Anxiety and depression is one of the major challenges. These are the leading causes, may be attributed with the certain other pathways. So this activity may enhances the quality of life. We can alter those unwanted behavior as well. So in this regard, basically we have set certain goals to achieve the target. So here the pharmacological evaluation of Cassytha Filiformss has been evaluated against the scopolamine induced neurodegeneration. Also, we have done antioxidant evaluation. We have performed to know the neurological neuronal cell death, as well as the brain protection, followed by the certain uh, uh, measures are there, like Y measure there, EPM is there, rotor order there. So these are the certain tools to manage those disorders. Naturally, there are alteration in biochemical parameters like dopamine, glutamate, acetylcholinesterase. So these parameters also were evaluated during the study to establish the possible mechanism of action by assessing the behavioral parameters and biochemical examination. So in this regard, there are a certain work which we have done, and this is the prelims work performed by several authors, like the reactive oxygen species and their products enhances the ADN set of action. That is work done by the Mahapatra et al. We have already published one of the articles which gives certain ideas, that is the past and present drug development. What are those possible challenges, what are the best drug and substitute, which was published by myself and my other co-authors as well. So it gives an idea how we can think up, we can plan for the uh, neurodegeneration, how we can manage with the alternates. So these are the certain works which we have performed in our laboratory. So myself and others, we have performed, that is phenytoin drug induced cognitive improvement. Also, we have a proof of this role of NMD and dopamine agonistic, followed by neuroprotective potential of metformin against the force swimming induced neurodegeneration. So these are the certain methodologies which we have followed for the assessment of neurodegenerations. So experimental animalia we have selected, followed by OECD, followed by CPCC guidelines. So for behavioral study, this bioimage, radial maze, elevated plus maze we are used, followed by antioxidant assay and biochemical estimation. So detection of dopamine and acetylcholine and other glutamate we have estimated as per the standard kit mentioned in the protocol. For the analysis of data, one way we are followed by a Tucky test to interpret the data, whether the data is having any significant values or not. So this is the prelims work. These are the certain plans to achieve the target. So now coming to the result and discussion. So here we can see, so we have used the methanolic extract of calcia uh, Filiformss. So two dose level we have selected, that is 250 and 500 milligram. So before that toxicity study we have performed, and as we knew that even in therapeutic dosage drug may have a certain severe side effect. So to avoid this ambiguity, we have performed neuropharmacological studies followed by the Irwin test to further reconfirmation and revalidation of the selected dose. So that was the one of the for the reason to opt the doses from the medicinal plant. So here we can see the percentage protection of the brain followed by the Y maze. So there is an when we induce the Alzheimer disease followed by this scopolamine induced model. So there is a alteration in behavioral parameters. So study we have compared all the group we have compared with the one way over followed by the Tucky test. So Y maze data indicates that there is an improvement with the treated group, that is the uh, methanolic extract of Cassytha Filiformss. Both the doses were effective. However, during the Y-image evaluation, we see there is a dose dependency. So, as we increase the dose, so we see the changes in the behavior. So, this is one of the score we have received. Also, we perform this radial arm maze test. The same behavioral parameters we have followed. So all the experimental we are done for the 5 minute duration. The time was constant for all those tests, and the data we are recorded. Here again, we saw there is a dose dependency. So both the doses shows the significant effect against the scopolamine induced Alzheimer disease. So there is a dose dependency. So we can see as long as we will increase the dose, so there is a changes and alteration in the behavior. So elevated plus may are also performed. So here transfer latency we are evaluated. So transfer latency we are evaluated, which indicates the significant alteration in behavior. So this is a further confirmation of neuroprotection. Further, this antioxidant assay we have performed. So here this SOD content we are determined. So here we, in case of this antioxidant assay, we did not see any dose dependency. So even in the lower doses of calcium methanolic extract of Cassytha Filiformss shows the uh, neuroprotection. So there is an interesting thing why there is no dose dependency. However, we see during the this APM evaluation, Y-image evaluation, there is a dose dependency. So here there may be other regions. So this effect may be attributed to the other pathway as well. So still there is a need to find out certain pathways. What are the possible mechanism? What are the possible targets due to which these alterations in results and modulations of the other parameters are being observed. Now coming to the next. So dopamine is one of the major catalytic agent biochemical parameters while evaluating this neurodegeneration. So when we induce the neurodegeneration using this scopolamine model, so there is an changes in dopamine level. So dopamine level goes down, while whereas while treating these treated group shows the significant changes and improvement in dopamine level. So dopamine level will rise. So it indicates that drug is having a neuroprotection. However, further we have to perform this activity to know the possible mechanism of action that I will discuss in upcoming slide. Acetylcholinesterase level we will also evaluated. So there is a significant changes in the acetylcholine level. Further, it indicates that drug is having a neuroprotective effect. So glutamate level we are also examined for both treated control and standard drug. So here we see the significant again there is a significant changes of treated group. So it indicates that drug is having a significant values while treated with, examination with the glutamate level. So glutam improvement level, improvement in this biochemical parameters further indicates that drug is having a potency to improve the degeneration of the cell. So there are chances of regeneration of cells. So further, quantitative and qualitative assay we are also performed to see the potency of the drug substance. So basically we have performed this alkaloid level. So alkaloid level we are present in the drug. So alkaloid may be one of the causative factor or phytochemical constituents which can be a catalytic agent for the management of neurodegeneration. Flavonoid level we are also examined. So it was present, it was isolated as well. So during the isolation, flavonoid and alkaloidal content we have identified. So these two constituents, we can say that these are the possible and potent constituents which can be or may be responsible for the management of neurodegenerative disorders. Phenolic content we are also examined. So further, this HPLC we are studied we are performed to see the purity of the drug substance. So it further it indicates that the drug is pure. Their purity we are examined, followed by the HPLC test. So these are the tests which we have done. FTI study also we have performed, which indicates that further the quantitative and qualitative assessment output further indicates that drug these phytochemical constituents like Cassytha Filiformss may be a potential candidate against neurodegeneration. So coming to the conclusion which we have received over throughout the research activity. So this administration of scopolamine for the 16 days, there is a changes in significant alteration in cognitive behavior. So methanolic extract of calcium filiformase prevent the scopolamine induced neurodegeneration by improving the spontaneous alteration, behavioral alteration, and number of correct responses, and reducing the transfer latency. So there was a significant improvement in the biochemical parameters like dopamine, NMD, and acetylcholine with methanolic extract of calcium filiformis. So they also increases the antioxidant level, so which we can conclude that this methanolic extract of Cassytha Filiformss may have a significant role and can be a potential candidate against scopolamine-induced neurodegeneration for the management of several neurodegenerative disorders like Parkinson and Alzheimer's disease. So qualitative studies also showed the presence of alkaloid, flavonoidal, and phenolic contents. So these three active components may be a promising tool for the management of neurodegenerative disorders. So there was a significant improvement in biochemical parameters which attributes the neuroprotection against the drug-induced Alzheimer's disease. So this effect may be attributed with the presence of alkaloid, flavonoid, and phenolic contents. So HPLC quantity also confirmed the presence of flavonoids. So these isolated compounds showed a single spot in TLC with the RF value of 0.95, and FTIR studies of the isolated compound shows the hydroxy group, an aromatic ring, and secondary amines which are present. So this can be a possible causative factor behind the management of Alzheimer's disease like neurodegenerations. So what we are expecting from these results, so after the comparative study we can expect that the methanolic extract of Cassytha Filiformss may delay the progression of Alzheimer's disease against drug-induced neurodegenerations. So these researches, these findings help us to the researchers and can open a new window for the uses of pharmacological uses of herbal drug for further management of neurodegeneration and for further research activity. However, we face so many challenges also while conducting this activity. So there are certain research, limitations also. So what are those limitations? So we knew that several conventional drugs which can't cross the blood-brain barrier. So this a lipophilic drug can easily cross the blood-brain barrier. So we have to um, uh, develop such a alternative tools from the phytomedicines which can easily permeate the blood-brain. So finally, we can conclude that this methanolic extract of calcium filiformis can be a promising tool for the management of neurodegeneration or any neurodegenerative diseases like Alzheimer's and Parkinson disease. Thank you very much. Thank you, Shari.
Thank you very much, sir, for your wonderful presentation about this plant for the neuroprotective activity. So the plant basically the Cassytha Filiformss. The plant is basically that is having the variegated purpose, variegated properties, and that plant has been should be you should be targeted as a CNS agent for the treatment of various neurodegenerative ailments. So that study was quite impressive, and your presentation was quite appealing. So that presentation will help the researcher for further research about the plant-based research for the neurodegenerative disorders as well as the targeting disorders for the treatment of various neurodegenerative ailments. Thank you very much, sir, for giving you precious time about this presentation. Thank you very much.
Thank you. Thank you. Thank you so much. Sir. Thank you. Thank you. Thank you. Shall I close the meeting?
Yes, sir. You can.
Yeah.